This.
Redo that.
I'm Justin Davis. The first test I'm going to demonstrate is the lever sign test. So this will be to test the ACL. You're going to use your hand to kind of make a lever under their leg here. And then you're going to push above their knee and watch their heel here. Their heel should lift up off the table, or the couch in this case. As you can see, it's coming up there, so that would be a negative test. If there is an issue or a tear in the ACL, for some reason that wasn't attached there, you'd push and there would be no movement in the foot. It would just kind of buckle down. And then we'll be doing the valgus stress test. So valgus force is this lateral force out here. So you just stabilize the shank here and apply that lateral force, and this is testing the MCL right here if there's any issues there or any laxity. And then you have the varus test. The varus force is the medial aspect, so same thing, but you're just applying pressure medially on that medial side, and that's going to test the LCL up here on the outside if there's any tears or problems there.
Sweet. Go.
And for both the valgus and the varus stress tests, you do those bilaterally to test if there's difference in laxity. If there's more laxity in one than the other, then that's a sign that there's an issue with that specific ligament.
My name is Aaron Gubler, and I'll be performing first the Apley's compression test. And for this one, it is a meniscus tear test. So we're going to bring the leg up here, the knee at a 90-degree angle. We're going to do an axial compression, so pressing down on the foot, and then also rotation of the ankle so we can tell if there's pain. We'll know if there could possibly be a tear. And then for this next test, it's called the McMurray's test, and this is going to be also for a meniscus tear. We're testing for pain and clicking as well with that range of motion. So we're just going to move through the range of motion, feeling for a clicking and if they have pain. And the last test is the Thessaly test. So we'll have our patient stand up, stand on one foot, and then rotate and on the knee. And if they feel any pain, that is a positive test. There actually is one more that I forgot. And then this last test that I will be doing is the hamstring 90-90 test. It will be testing for tight hamstrings. We're going to have the patient lift up his thighs to like a 90-degree angle at the hips, and then we'll have them raise their knees up or flex their knees as high as they can go. And if this angle here is greater than 20 degrees like off of where it should be, then that is a positive test for tight hamstrings. But, yeah.
My name is Jenica Davis, and first I'm going to do the patellar apprehension test. So for this one, you'll push the patella laterally, looking for any apprehension or flinching in the muscles around the patella. If there is, then that means that they have probably had a subluxation at some point and they're trying to prevent the patella from moving out of place again. For the second test, I'm going to do the patellar grind test. For this one, I'm going to apply pressure superior to the patella. I'm going to do it on this one. Superior to the patella, and ask the patient to contract their quads. If there's pain near the patella, then that is a positive test. For the next test, I'm going to do the sweep test. So for this one, ideally the patient would not be in jeans so that we could properly do a sweep of their knee, but you're going to push upward, looking for movement of fluid through the knee and up the leg. And then for the last test, I'm going to do noble compression test. So for this one, I'm going to apply pressure superior to the femoral condyle, and then I will move his leg through a full range of motion. And this is testing for pain for the IT band. If there's pain there, then you know that the IT band is having some issues.